Hi. How may I help you? Yeah. We spoke on the phone earlier. The patient with photosensitivity and the ongoing headaches. Yeah, I remember. Well, I am the head of the neurology department, so that is precisely my area of expertise, so you came to the right place. Now, I just need to pop back into my office and get some emails and prescriptions written up. So what I'm going to do is I will page downstairs, see if there's any nurses available to pop up, and they can get your basics, get some information off you, get your heart rate, blood pressure checked, all that kind of stuff. And then they can send you back to me in the exam room, and we will try and drill down on what is causing the issues. Okay? Sound good? Lovely, okay. 2 seconds. Hi, Lynn. Hi, it's James. I am currently with a patient waiting for a neuro exam. Just wondering if anybody is available to pop up and get them booked in and do some vitals. Yeah. Oh, is Shani available? Yeah. Yep, just send her up, that's great. Okay, lovely, thanks, bye. Bye-bye. Well, it looks like Nurse Shani is available. Not only is she very capable, but she's also very likable. So I leave you in very safe hands, okay? Okay, I will see you momentarily.
Hi there. Welcome to the ASMR clinic. I'm Nurse Shani, and it's a pleasure to meet you today. So, our Dr. Denton will be with you shortly. I just need to get some information from you to get started, okay? Just a quick little check-in. I apologize for our computer systems being down, but I'll just get some brief information here from you, and I'll get it all worked out shortly when they're back up. So, can I have your first and last name, please? Okay, very good. And have you been to our clinic before? Okay, first time. Wonderful. Do you mind me asking how you heard about us? Okay, a referral. Perfect. Now, what brings you in today? Are you looking for a physical, an examination for maybe like any physical ailments or eye exam? Okay, not a problem. We can definitely assist you with that today. I'll make sure I let Dr. Denton know. Okay. Now, do you have any allergies that we should be made aware of? Any allergies to any medications or any allergies to latex? Okay. And are you currently taking any medications or prescriptions that we should be made aware of? Okay. Have you recently had any surgeries or any hospitalizations? Okay, very good. And what's your past medical history like? Do you have any issues that you've gone through in the past, any prior surgeries, maybe how your immediate family history is, any cancer or illnesses that could be genetic? Mm-hmm. Mm-hmm. Okay. It's just good to know so we know what to look for throughout your examination. Okay. And what insurance do you have? Okay. And what is the group ID? Okay. Normally I would ask for a photo, but since our system is down, we'll just take it from there later. That should be all the information that I need for now. Okay. You don't currently smoke or use alcohol recreationally or anything? Okay. Very good. And lastly, what would you say your diet's like? No, that sounds normal. Not too bad, though. I would definitely try to work in some more fruits and vegetables. Okay? And are you drinking enough water, staying hydrated? Okay, good. Alright, that should be everything I need. So far from what I see, you seem pretty healthy, so that's very good. Well, we go ahead and get started on your vitals. I'll get those out of the way, and then Dr. Denton can take a more thorough look at you. Normally we'd get your height and weight, but it seems that you wrote that down here. When was the last time you had that verified? Okay, not too long ago. So I'll trust you on that. That should be good. Okay. Let's start by listening to your lungs and your heart, okay? I have my stethoscope right here. Now, it may be a little cold. I'll try and warm it up real quick. Okay. Would you mind just lifting your shirt slightly for me so I can take a quick listen? Thank you. Okay. I'm just going to have you breathe in through your nose and out through your mouth. In through your nose, out through your mouth. And keep that going for me. In, out, in, out. Now I'm going to have you breathe in again, and this time hold it for 3 seconds and then release. Here we go. 1, 2, 3, and release. And one more time here. In through your nose. Hold it. 1, 2, 3, and release. Very good. Yes, you can put your shirt down. Your lungs and heart sounded great. didn't hear any issues. Sounded like you were getting a good breath in, so it's very good. Let me just write that down here. Okay. Lungs and heart. Very good. Strong heartbeat. Lungs sounded strong. Okay. Next, I would like to get your blood pressure. So if you could just roll up your sleeve for me. I'm going to put this around your arm here and give it a couple pumps. Very good. Alright. Looks like it is 120/80. You can roll your sleeve down. That's good. You have a great blood pressure. It is a fiddle so far. Lastly, I'd like to just get your heart rate. Okay? So, I'm going to put this on your finger here and start it. And we'll just give that about 20 seconds. Yes, just try and remain still if you can. I know it can be kind of hard, but it'll be over before you know it. 13, 14, 15, 16, 17, 18, 19, 20. Here we go, and great. That all looks good. So your vitals check out. Nothing to be worried about or concerned about. You seem quite healthy. Alright, I'll make sure I put that in our system, and I'll let the doctor know, and he should be in shortly, okay? Any questions you'd like me to let him know about? Oh, it's not a problem, okay? I'll make sure he knows. Alright. Enjoy your appointment, and I'll see you soon.
Hi, welcome back. How did you get on? Yes, Nurse Shani really is fantastic, isn't she? I'm glad you guys got on. Alright, so just looking over your vitals here. As a starting point, I don't see anything too concerning. Have you had a full neurological exam before? Well, I mean, not everybody has, so it's basically an assessment where we cover quite a few bases. So we start with your motor and sensory skills. We'll do a little bit of balance and coordination. We'll assess your mental status, but this is sort of your level of awareness and sort of how you interact with the world around you, rather than like an emotional reading. Then we'll move on to your reflexes, and finally your nervous system, cranial nerves. Okay, so I mean, it is fairly comprehensive, but it's going to help us to really pinpoint where the issues you're experiencing are coming from. Okay, good. All right, let's start with a few basic questions just to make sure you're nice and grounded and all with it, as we say. That's the technical term. These may seem very simple, but please just answer as directly as you can. Do you know where you are right now? Correct. Do you know what day of the week it is? That is also correct. Do you know what the purpose of your visit was today, or is today? Yep. What is the name of the country's current world leader? And can you name a recent sort of notable event in the news? Anything that's caught your eye within the past couple of weeks that everybody's talking about? That'll do. If you could, just count backwards from 10 for me. Very good. And if you could, just spell the word doctor. Very good. So you seem to be all there, all with it. You're not confused as to what year we're in or what day of the week it is, which is a great start. I'm just going to pop some gloves on. Alright, now I'm going to start by what we call palpating the sinuses of the face, which is a very fancy way of saying I'm just going to lightly press around this area here. Okay. Alright, now I'm just going to ask if there's any tenderness or soreness in the areas. If I press here. Okay. Any soreness or tenderness pressing here? Here. Okay, just along this bit. When you experience the headaches, are they localized to a specific spot? So oftentimes people get them in the temple region or the sinus region, which is where we're just checking out now. So around, yeah, okay. Just gonna press here and here. Okay. If you could just close your eyes for a second. I'm just going to gently press on top of your eyelids. Any soreness or pain there? I'm just going to hold the top of your eyelid and then press under here. Alright. Same over here. Okay, looking good. Alright, let's just write that down. Okay, sticking with the palpating, we're going to just do your lymph nodes now. There's a couple on the head and neck, so it starts behind the ears, just here, and then we have some here. This is near your voice box, and then lastly underneath your chin. Okay, just going to move in a little closer. Alright, let's start just underneath the ears. They don't seem to be swollen. Any extra sensitivity here? And on this side, no. you just move your head back like so. Alright, okay. I'm just going to move on to the ones on your neck. If you could just swallow a big gulp like that. A little bit of swelling there. We had a cold recently. Do you work in a job where you have to raise your voice a lot? Okay. I mean, it's not too bad, just a little bit. A little larger than I would expect on this side. Head back again, I'm just going to feel underneath the chin region. Yeah, these are swollen too. I mean, I don't think this is related to the headache issue, but just something to maybe keep an eye on. I mean, generally they look fine though. Lymph nodes seem okay. Just turn your head that way. And that way. Alright, okay. Alright, let's move on to the head and neck ROM. See range of motion. Okay. Just gonna move your head in certain directions it should naturally go. So we're gonna start in the center, okay? And just turn very slowly over to this side. And just keep it there. Alright, let's move it very slowly back to the center. And now we're going to go very slowly this way, okay? Just moving your neck that way. Okay. Yeah, you can see this like swelling there. Alright, I'm just going to move it back to the center. Okay. Now, keep it centered, and if you could just drop your head. Like that. Okay, now all the way up and as far back as you can go. Okay, back to the neutral position. If you could just raise your shoulders up like in a shrug, like don't care. Alright, and back down. Can you pinch your trapezius? That's this muscle. So where your neck connects to your back. Can you sort of pinch those together to pull your chest back? Alright, and now hunch them forwards like this. Great, I mean that's terrible posture, but I mean I've asked you to do it, so you can't really be blamed. Yes, I always used to get told off for hunching over my desk while I would write prescriptions. Alright, that looks good. Let's move on to facial muscles. Okay, just raise your eyebrows up. Raise them up. Back to neutral, and now a frown. Frown. Scrunch your nose like this. Yep, okay. Alright, let's blow the cheeks out. I know these seem a little bit nonsensical, but just making sure that the signals going to your brain are being translated through to your muscles. Okay. Can you scrunch up your eyes like this? Okay. And open them really wide. Alright. Give me a smile with your teeth. Doesn't have to be a Hollywood smile, just as long as your teeth are showing. Okay. And now a shocked face. Open your jaw wide. Alright, okay. And now clench your jaw down together. Clench your teeth. One more. Okay, can you stick your tongue out? Alright. And just say ah. Okay, good. Right now, I'd like you to close your eyes like this. Just gonna gently press here. Okay, and now with your eyes closed, I'm gonna give you some instructions like this. And ask you to look in different directions. If you could just follow those instructions, okay? So eyes closed. If you could look directly upwards. Okay. If you could look back to the middle. And now to your right, my left. Okay. And now to my right, your left. Looking that way, back to the center. And now, if you could look down, keeping your head still, just moving your eyes. Okay. If you could look lower diagonal to the your right, my left. Now, your left, my right, lower diagonal. So it's okay. And now up and right. Up and left. Can you go cross-eyed? Both eyes in the center. Okay. You can open your eyes, just give them a blink as you reacclimatize to the room. Very good. Let's check the scalp, shall we? Alright. Just popping your head down again like this. I'm going to feel over the scalp area. Okay. Skull looks fine. A little bit of redness up here. Do you suffer with dry skin? Any skin conditions in the family? Psoriasis, anything like that? No, okay. Anything can cause that, to be honest. Just stress, wrong shampoo, dehydration, bad food. Alright, let's go through the visual quadrants. Now, I am aware that obviously one of the issues we've got is photosensitivity, so not liking too much light exposure, so I'm afraid this might not be the most pleasant of experiences. However, I'm just going to cover the end of the light like that. Can you see the light through my fingers still? Alright, so without moving your head, just looking straight ahead, I'm going to move the pen light through your 6 visual fields, and you're just going to follow with your eyes, okay? Ready? Don't move your head. So that's from the bottom to the top, back to center, to my left, over to my right, back to the center. Now we go here, and we go up here, and then back to the center, down to here, up to here, back to the middle. Good, you're doing very well. Just close one eye. Doesn't really matter which. Looking ahead. Doing very well. Okay, let's switch to the other eye. Can you still see the light? Good, I'm just trying not to blind you here. Alright, looking straight ahead and not moving the neck or head, just moving your eyes. Up, down, to the middle, to the right, to the left, back to the center, to the bottom corners, to the upper corners, circular, back to the center. Alright, good. Let's just record that. I'm doing well so far. I have a couple of theories as to where the issues may lie. Okay. Just gonna briefly check your balance. I'd again like you to steady your head in a neutral position, like so. Just staying here. Alright, I'd like you to close one eye, or keep your hand over the eye. Alright, make sure you just stood comfortably, and if you just stay looking ahead and raise one leg if you can, and just stand balanced on there while focusing right here. Okay, ready? Okay, staying on that leg, just following my finger. Very good. You are right-handed, left-handed? Okay, you can rest that now. Okay, now same again. Cover the opposite eye. Looking straight ahead at my finger. And we're going to go on the opposite leg now, okay? So, ready? And balancing, there we go. And now just following the finger. It actually helps to be focusing on my hand rather than balancing. It's an old trick, but it does work. Now, you don't have to be incredible at this, just as long as you're not falling all over the place. Alright, good, yeah. It's fine. I'm sure you would pass a drunk driving test. Alright, let's do your peripheral. Okay, just sitting back in your seat. There we go. And again, I'm going to have you cover one eye. Alright, and I'd like you to look straight ahead. Just pick a spot on my face anywhere. I'll just look in the center. And I'm going to have my glove here. I'm just going to move it about, and I'm going to hold up various numbers, and so 4, 2, 1, etc. I'm sure you understand what numbers are, and I'd like you to just report back what you see. Don't look at my hand. Okay, that's the one rule, and obviously don't move your head, the second rule. Ready? Staying still. Looking here, and yep. Good. 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 Now peeking. Good. Looking here. Great. And okay, cover the other eye. Doing very well. Yep, by all means blink. Just don't want to wear out your eyes. Obviously, we've got to go through these tests, but take all the time you need until you're ready. Alrighty, looking straight ahead. I'm gonna hold up my hand here. Ready? Yep. Yep. Mm-hmm. Doing very good. Mm-hmm. Okay. Let's have a look for your blind spot now. So, switching back to the other eye, I am going to move my finger progressively outwards, and it's going to hit a spot, usually around here, where it's going to leave your vision and then reappear. This is known as your blind spot. So I'd just like you to let me know when it reappears and disappears, respectively, okay? And again, just looking straight ahead, it's very important that you don't move your vision on this, otherwise, obviously, your blind spot will move with it. So, looking here. Okay, so just let me know when my finger disappears and reappears. Good. At some point, it will leave your peripheral boundaries. That's fine, just let me know when it disappears. And when it reappears, good. Let's try down here. Just letting me know when my finger disappears and when it reappears. Disappears and reappears. Okay, we're going to move up here. Let me know when it disappears and reappears. Disappears and reappears. Great, fantastic. Switch to the other side now. Cover this eye. Looking straight ahead. Okay, ready? Alright, okay, so letting me know when my finger disappears and reappears. Good. Down here, disappears and reappears. You're doing very, very well. Well done. Disappears, reappears. Let's try up here, letting me know when my finger disappears and reappears into your vision. Disappears and reappears. Okay, good. Just one last test on the blind spot, looking straight ahead, okay? Very good. Now, I'm going to move them in, and I'm going to guess your blind spot is somewhere around here. Can you see my fingers right now? Nope. Okay, I'm going to move them up. They should appear. Yep. Can you see my fingers? Good. And there should be another one up here. Can you see my fingers? Good, okay. Happy with that. Let's grab the ophthalmoscope, shall we? This is just a rather fancy tool for looking in the back of your eyes, okay? Just looking straight ahead. Okay. Looking in the back of your eyes now. Do you wear glasses? Do you watch a lot of TV? Okay. And these headaches, do they tend to happen around the TV watching, before bed, in the morning? How much screen time would you say you average? A day? Yeah, well, I mean, I have to use it for work too, so kind of screws the statistic. Alright, just looking straight ahead. Okay, covering this eye. I'm going to check a swinging flashlight test. This is just check response in both pupils, okay? Alright, ready? Looking ahead. Direct response looks fine. Alright, if you could just uncover the other eye. Just pick a spot behind me or look at my ear. It's the consensual response, okay. Cover whichever the... Yes, that's the one. Alright, ready? Just looking at this ear or behind me. Okay, uncover the eye. The consensual dilation is definitely happening. That's good. Okay. Let's quickly check your hearing acuity. I will need my other glove for this. Alright, so keeping your eyes straight ahead, or you can close them, I am going to bring my hands just around the side of your ears, okay? And I'm going to make some small rustling noises. I just need you to tell me which side you hear it on, okay? Left or right. Very straightforward. Ready? Very good. Yep. Let's check if you can perceive words properly. You've been doing fine with the exam so far, so either pick a spot just that way or close your eyes. Ideally, I am just going to whisper some animal names, let's have animals, into your ears. I just want you to repeat back the word that I say, okay? Start with the right hand side, okay? Alright, just no peeking, looking that way. Ready? Penguin. Elephant. Dog. Cat. Giraffe. Orangutan. Zebra. Wolf. Hamster. Guinea pig. Parrot. Whale. Prawn. Tuna. Spider. Centipede. Buffalo. Cow. Sheep. I think that was all of them. Well done. Okay, and we'll do the same on the other side. Just picking a spot somewhere over there. Ready? No. Zebra. Anteater. Wolf. Mongoose. Sausage dog. Sheep. Horses. Moose. Camel. Lion. tiger, seal, goldfish, shark, bat, lizard, buffalo. Very good. Well, hearing is not a problem, it doesn't seem like. Alright. Let's do a little bit of sensation on the face. I'm going to use a tuning fork for this, okay? So, now, little tuning fork here. What I'm going to do is ping it, okay? And I'm going to place it just here on the center of your forehead. Take this off, because I don't need it anymore. And then move it from cheek to cheek, and I want you to tell me if the sensation feels equal on both sides, okay? Alrighty, okay. Ready? Okay, can you feel the vibration? Does it feel equal on this side as to this side? One more time. And on your forehead and your chin. And on this side and on this side. Can you feel the vibration equally? Okay. Let's pop that down. Here I have a brush. What I'm going to do is I'm going to use the soft or the blunt side of the brush. I'm going to have you close your eyes as well, and I'd like you to tell me which side of the brush it is. This is just making sure that your perception of touch is all there, and you can feel both the relatively hard and very sort of light sensations with the brush, okay? No peeking, I mean, you're only really cheating yourself. Alright, eyes closed. Which side is this? And this. And this. This. Which side is this? And this. And this. This. And over here, which side is this? Does this sensation here feel equal to this sensation? And here, and here. Here and here. And which side is this? This. This. This, 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 and this, and this, and this, and this. Okay, great. Yeah. Alright, nearly done. Must say you've done very, very well so far. Okay. So, I know that your heart rate was checked before, but I want to check your breathing and your lungs. I'm going to listen to a couple of key points of your chest, your aortic and your back area as well. Let me just see what Shani put for this. She didn't check the lungs, just heart rate. Aortic not checked, pulmonic not checked. Okay, that's fine. Alright. going to do this as uninvasively as I can, okay? Just going to pop this at various points over your chest. I'm going to start here. I would like you to adopt a very deep breathing style, okay? So, I want you to fully inflate your lungs as you breathe in. Fully inflate them, all your lungs. And now blow all the air out. And second pressure point just here. Fully inflate your lungs. And really deeply exhale. All that air. And again over here, fully inflate the lungs. Blow all that out. Great. Alright, round the back, okay? Alright, one more time. Really big, deep breath in. Keep going. Alright, now big exhale. Keep going. Good. Lastly, we're just going to go over this side. Okay. Really big deep breath in. Fully expanding the lungs. Very good. Keep going. Okay, hold that. And now, fully pushing all that air out. Keep going. Good. Very just lastly, down here. Big deep breath in. Keep going. Exhale, pushing all that air out. Very good. Good. All right. Okay. All right. Well, I think it could be a number of factors, but I think there are some things that are definitely not helping. So, you noted that you recovered from a cold recently. I think that's got some residual swelling in your lymph nodes, and also is still putting a little bit of tension and strain on this area and sort of bunging up the T-zone. Your sinuses still are a little bit inflamed. That can contribute towards the photosensitivity. The other thing is you're showing a few classic signs of tiredness, overtiredness. So, I mean, I would hesitate to put you onto some kind of sleep aid yet. It's really just for short-term use only. If the lack of sleep turns chronic and it's like a chronic insomnia problem, we can look at some remedies for that, some medication. However, I am going to have Nurse Shani give you a booklet. This has got all kinds of tips and tricks for nighttime habits to form that are going to make sleeping and getting to sleep and having better quality sleep better. If you can, try to move any arrangements that aren't set in stone to a little bit later. So if they were going to start at 9 o'clock, maybe move them to 12, just to give your body a chance to really take advantage of those days off work and sleep in. Okay. As for the photosensitivity, I would recommend sunglasses outside for the medium term. You won't have to wear them forever, but while still recovering from the infection. Speaking of that, I'm going to give you a 3-day antibiotic course because I can see some residual effects from that, so I want to make sure it's fully out of the system, it's not causing any harm. You should start to notice the photosensitivity decrease after that. Also, the lack of sleep is not going to help. You'll notice in the morning it's very hard to open your eyes, and this can persist for a couple of hours with some people. I will give you some light medication. It's not strong. That should help your eyes to just relax a little bit. And I'm also going to give you some eye drops. These are just to moisten your eyes, but the dryness can really sort of make them feel overstrained, which in itself contributes a lot towards headaches. I think that's it. Yeah, everything else seems pretty good. Yeah, I will send a copy of this through to Nurse Shani. I'll get her to go over the sleep tips with you, and she will give you instructions on the meds and how to use the eye drops properly, okay? Good, I'll just sign that. Alright. Take this, give it to the lovely lady at reception. She's called Lynn. She'll give you a hand with all that, and yeah, let's schedule an appointment for a checkup in a couple of weeks, and we'll see how you're getting on. If it persists, we'll look at some more aggressive forms of action. But for now, I think this is a good starting point. Okay, well, thank you so much for coming in. I feel we've made some good progress today, and I look forward to seeing where we're at in a few weeks, okay? Lovely. Alright, get some sleep. Make sure to get some quality sleep, that's important. Okay, fantastic. I'll see you later.